Hello everyone, I am Dr. Vidyasagar Chandankere, pediatric orthopedic surgeons at KIMS Sunshine Hospitals. So today I will discuss one more common problem, which is bow legs and knock knees. These two things I am going to club and talk together, and it's a common worry. Almost in every OPD, half of the patients have this, either bow leg or knock knees. So I'll tell you at what age it is considered normal, and then I'll also tell you when it is abnormal and when you should actually seek consultation with your doctor. So first thing is, less than 3-year-old children, bow legs is quite normal and very common. Never compare your child with a neighbor's child or a family friend's child or any other relative's child. Your child is different, unique, and what others have, your child might not have, and what your child has, the others may not have. So, and even in children also, siblings, don't compare that first child had bow legs and second doesn't have, why is it there? So it's a developmental phenomena, and it's a normal process during growing age. So any bow leg child less than 3 years should be considered normal unless you see these red flags. So I'll tell you how to commonly identify these red flags. So first thing is, if you are seeing that there is an increasing deformity, that means the bow leg is becoming more and more every 3 months once and 4 months once you see that. So that means it's not normal, then you need to have a consultation. Another red flag would be if you see that it is unilateral, that is one-sided bow leg. Again, it is not normal or physiological. The third thing is when it is asymmetrical. Sometimes some children have bow legs more on one side and less on other side. Even that I would say is not normal and requires consultation. The last would be if the child has, while walking, you notice a lateral thrust. That means the child bends to one side and puts excessive pressure. The knee bends more while walking. That again would be one more red flag. So if these 4 are there commonly, then I think you should consult a doctor and see. The common causes for bow legs other than the physiological normal cause would be vitamin D deficiency and Blount's disease, and very rarely we get a condition which is called as focal cartilaginous dysplasia in the tibia. So that could be one of the rare causes. Coming to bow leg, so if you see any child with bow leg who is more than 3, it is not normal and requires treatment. So parents generally ask what happens if we leave it like that. So I'll answer that question. Normally our bow legs are a pillar for our body. Like any building has a pillar. Normally if you see all the buildings, pillars are straight. You won't see a crooked pillar. What happens is the crooked area gets more stress. So that's what happens at the knee also. The knee gets more stressed, and you might see with time there is growth abnormalities, and sometimes even it may lead to progression. So the limb doesn't grow normally if there is unequal distribution of the pressure. That's the reason we want it to be straight. And normally in adults we get about 4 to 5 degrees of valgus angle, but in children, again that's why we need legs to be straight. So certain age group is there less than 3 years, bow legs, and then from 3 to about 4, 5, 6 or 7, they may have slight amount of knock knees, which is again normal. And when do you find knock knees? Normal range is around 3 to 7 years is normal. And what we must measure is simply when the child is sleeping or standing, we can measure the distance between both the foot with the knee touching together. Knee should touch together, the foot should be apart. In that position, if you measure the distance is less than 9 centimeters, then it is usually normal. So there again also red flag is if it is unilateral, that means one side, or if it is asymmetrical, that means one side more than the other, or if it is progressive, then it's abnormal and you need a consultation. Vitamin D deficiency again is a common cause. So now you know what to do when you find one. If you have any questions, you can also ask in the mentioned link below. Thank you.